banana-shaped uterus seen in a 31-year-old Nodipara who presents with inability to conceive and was discovered during investigations to have a unicornuate uterus with a functional, non-communicating rudimentary horn. Unicornuate uterus belongs to class U4 in the European Society of Human Reproduction and Embryology Classification and the European Society for Gynecological Endoscopy, and class 2 in the American Society for Reproductive Medicine. These are the four types of unicornuate uterus. Unicornuate uterus with communicating rudimentary horn, unicornuate uterus with non-communicating rudimentary horn, which is the most significant, rudimentary horn without cavity, and unicornuate uterus with no rudimentary horn. There are two Mullerian anomalies that are mostly associated with renal anomalies, one of which is unicornuate uterus in about 30 to 40%. The other is Meyer-Rokitansky-Kusa-Husa syndrome. So, what is the significance of the condition in these patients where there is a non-communicating functional horn? Because menstrual blood has nowhere to exit, and so the patient will develop hematometria. Classically, these patients have severe dysmenorrhea soon after menarche because of this collection within the functional rudimentary horn. The risk of endometriosis is high because of retrograde menstruation. Most importantly, pregnancy can implant in this functional rudimentary horn, and these pregnancies rupture early. Most times, it's mistaken for ectopic pregnancy, and these ruptures are associated with massive intraperitoneal hemorrhage. In the non-pregnant, like in this case, management is to exercise the functional rudimentary horn. It's important to note that preterm labor is extremely high in patients with unicornuate uterus, and that is why some suggest insertion of cyclage. So cervical length monitoring is important, serial growth monitoring is important, and early dating, especially in cases where surgical correction was not done. Now, this is the typical description of a normal uterus, pear-shaped. This is the typical description of a unicornuate uterus, banana shape. So if you look at these two, where is pregnancy likely to stay of the term? Is it in a pear-shaped uterus or in a banana-shaped uterus? So today it is in a pear-shaped uterus, and that is why preterm birth is extremely high in cases of unicornuate uterus. Now this is a 3D image of a normal uterus, as you can see, pear-shaped normal uterus. This case was suspected on 2D. Here you can see the longitudinal section here and transverse section here. Look at the endometrium here, the normal cavity, and look at the short endometrium here in the rudimentary horn. Here you can see the endometrium, and you can even clearly see the junctional zone here. Look at it here on transverse section. So this was suspected on 2D, and so she had a 3D, and 3D confirmed this unicornuate uterus here, which is banana shaped, and here you can see a functional rudimentary horn which does not communicate with the main endometrium. So this is what this patient has: a unicornuate uterus with a functional non-communicating horn. Unicornuate uterus with a functional non-communicating horn. So you see that? So thank you very much for listening.